Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and today we're going to look at some more A&P. Specifically, we're going to check out the little intrinsic hand muscles that let you do really detailed, complex hand motions. So, let's check it out. So last time we checked out some muscles of the forearm that helped us move our fingers on our thumb and our hand, but I want to look at some muscles called intrinsic hand muscles that are only found in the hand, not within the wrist or the forearm, that help us do detailed finger and thumb actions. Think about live long and prosper and how you perform that action. Try it yourself if you want. You're using some of these muscles. Make a sock puppet hand, right, where you make your hand talk. These are using these intrinsic hand muscles. Something like knitting, where you have to do fine detailed action of thumbs and fingertips, are going to use these types of muscles. Someone like a speed cuber, like we see here, yeah, he's using some pronators, supinators of his forearm for sure, but he's also using some of these tiny intrinsic hand muscles. And then of course your favorite uncle who likes to pull his thumb off and scare all the little kids, he's using these muscles as well. So let's check them out a little bit. THENAR muscles. So when you think THENAR, think of the lump of tissue, mostly muscle there, that's right under the thumb. Think THENAR thumb. And so we see a red, blue, green set of muscles, a group of 3 here, that helps us move the thumb. And they're pretty much self-explanatory based on their name. We have a short muscle that flexes the thumb, right, the pollicis. So we call it flexor pollicis brevis. That is the red one right here. We have an abductor, right, to move away from the palm. Pollicis brevis, a short muscle that abducts the thumb, and that's this fella right there. And then we have an opponens pollicis. And if you want to practice this, basically take the tip of your thumb and touch it to the tip of the first finger, then touch it to the tip of the second, and then the tip of the third. What you're doing is called opposition. And you are opposing the fingers as well, but you're really doing an opposing of the thumb in this particular action. So opponens pollicis helps you oppose the thumb. Now hypothenar will refer to the fatty bunch of tissue right under the pinky. So we have 3 muscles here as well. One of them lies deeper. So in green here we have what's called flexor digiti minimi brevis, and of course that's just like it sounds, a short muscle that helps you flex the small finger, right? The pinky finger is what most people would call it. It's a pinky flexor. And then right by its side we have an abductor digiti minimi that would help move the pinky finger away from the rest of the fingers. Now this third one down here looks kind of weird. We've got a hand without the phalanges, so all we see are the metacarpals there. But right here, it's a little deeper to those other 2, is another opponens digiti minimi. And real quick, touch the tip of your thumb to the tip of your pinky. And you're not only using that opponens digiti minimi, but you're also using what we saw right back here, the opponens pollicis. Okay, if you're not a thenar muscle or a hypothenar muscle, the chances are you're called a Midpalmar muscles. And again, these are going to help you extend, abduct, adduct, do those intricate finger motions we saw like when you're knitting and so forth. Adductor pollicis, palmar interosseous, and sometimes because there's multiple ones, you call these palmar interossei. Same thing with the dorsal interosseous muscles, you could call them dorsal interossei. And then the lumbricals. So the sock puppet, or the puppet muscles, are the lumbricals. And you see them over here. They are numbered 1, 2, 3, 4, just like the Roman numerals. Without getting into the details, take your middle 2 fingers and kind of push them into your thumb, just like you're making this puppet here, but push down and continue to push. And you should feel a little bit of pain maybe if you have a really strong grip. Up there. That's your lumbrical saying, we want you to stop doing that, please. So if you want to both open your fingers like that and then bring them back down like a puppet, you would use your lumbricals. Now, of course, your thumb is not using the lumbrical, but I think you get the point. Okay, so now we're going to fan out our fingers and then bring them back to the midline, right? So we're going to do the abduction of the fingers this way when we do the fan, and when we bring them back together, we're going to do an adduction, right? So these two interosseous muscles, there's several of them here in two sets, the palmar interosseous and the dorsal interosseous. Again, you can use the plural here and call them interossei. So do that real quick while you're sitting there. Do abduction and adduction of your fingers in front of your face, and notice that this middle one, your middle finger, doesn't move very much. And the reason is because the palmar interossei don't actually touch that middle finger. And notice here the dorsal interossei kind of wrap around it, kind of horseshoe that thing and collar it and keep it from moving. So when you do that abduction, adduction of your fingers, that middle finger doesn't move very much at all. Okay, we'll end off with how the thumb gets across the surface of the palm. This is done with a special muscle known as adductor pollicis. Now, of course, do nothing more than pull this thumb toward the midline of the hand. All right, hope you enjoyed that quick talk on the hand muscles. Thanks for watching it. Check out some more if you want to learn more about A and P. I'll see you for the next one. Bye-bye.